Hello and welcome back. Thank you for joining us here at Enhanced Wellness Living for our Women's Health Hormone Summit. I'm Chelsea, your functional medicine health coach, and today Kelly, our founder, will be walking us through thriving through menopause.
Guys, welcome back. If you have been participating in this Women's Health Summit, thank you for being here. Thank you for submitting your questions because those have helped us drive some of this conversation around these various phases in life. And I want to give a big shout out to the team because none of this would be possible if it weren't for Chelsea and Abby and all of the team that pulled this together to make this happen. So thanks to everyone. So today we get to talk about menopause. And what I'll say about this is we have arrived, right? We get to spend about a third of our life in menopause if we're lucky. And so it's a big, important time in our life. It's oftentimes something that we don't necessarily feel empowered to talk about. But I want to open up the conversation today because there's a lot to unpack here. There's a lot we could be doing to improve our overall health during this time of life. So as we age, it's no secret that our hormones change. And we oftentimes get stuck on talking just about estrogen. So when we think about hormone balance for this stage of life, our body was made with a backup plan. God gave us our adrenal gland. So even after ovarian production of estrogen goes completely away, whether you have gone through menopause, or you're no longer ovulating, and you've been a full year without a cycle, or you've had surgical menopause where your ovaries are removed, so you don't have any ovarian output because you just don't have ovaries. Regardless of the reason, we do have a backup plan, and we'll talk about our backup plan in the adrenal glands in a little bit, but we have a way of making estrogen in other ways. The adrenal glands is one way. Of course, ovarian is the primary way. And then even in our fat tissue, we can make estrogen. And then we don't want to forget the environmental exposures to estrogen. And we'll talk about that a lot today because that can oftentimes make us estrogen dominant, even when those ovaries are not producing estrogen. And that can really confuse us when we're thinking about hormone balance. But hormones are important. There are ways that our body communicates. We can communicate through hormone production and then what those hormones do throughout the body. So there's a lot to consider when we think about hormone balance. We think about our energy, we think about our mood, we think about how well we're sleeping, of course, our metabolism, and we know that our metabolism changes. We see that changes around age 30. We see it change again around age 40, and then around age 60, dramatic changes in metabolism, where we change the way that we're using insulin in a very profound way. And that's where cortisol and insulin balance become really, really important. Of course, we're past the age of reproductive health. And as I was thinking about this talk today, I started digging into, what are the other mammals that go through menopause? And the only other animal that goes through menopause is actually whales. And menopause is very deliberate. It's our time when we can use our wisdom to nurture upcoming generations. So as grandparents, it's our time to pour into our grandchildren. If we don't have grandchildren, it's our time to pour into maybe friends or families, nieces and nephews, that kind of thing. But there's a lot of wisdom that we can impart. And so this was a very intentional design in the female body where we are not so focused on, can I get pregnant or can I prevent pregnancy? We spend so much of our energy thinking about getting pregnant or not getting pregnant, right? And so this is a fun time in our life where we're not thinking about that anymore. We can really pour into the next generation to come. And then as we age, we really want to age gracefully, right? We want to make sure that we're not developing chronic disease states that would rob our joy, rob our time, rob our attention, and prevent us from showing up for our friends and family the way that we want to show up for our friends and family. So super excited you're here because we're going to dig into all of this today. So all the 4 phases of life that we get to experience hormonally, we're talking today about the menopause and postmenopause. So just as a refresher, menopause is when you've gone 12 consecutive months without a menstrual cycle. So whether that's surgical menopause, where it happens immediately, or it's natural menopause, where the ovaries just decline over time, it's that first full year without a menstrual cycle. And then you're considered postmenopausal, right? So menopause technically is 1 day. and then postmenopausal is after that. There's so much more to consider with hormone balance than just what's going on with your sex hormones. Now, don't get me wrong, sex hormones are really, really important. And I would challenge you, if you are postmenopausal, and we've got women all the way from age, if it's surgical menopause, you could be as early as 30, maybe even younger, all the way to 80, 90 years old, that are in this postmenopausal range. So we're talking about a really broad range of women. Like I said, if we're lucky, we get to spend about a third of our life in menopause. So it's a really important time to understand hormones. But I would say the caution is, if you have been into your provider and you were just prescribed hormones, but we really didn't look deep into what's going on with the adrenals, what's going on with the thyroid, what's going on with your inflammatory burden, what's going on with your cardiovascular health, then I would say push the pause button and go back and let's look at those things, because those things are essential in not only getting you balanced, hormonally speaking, but keeping you balanced. And as I mentioned, aging gracefully, so that we're not putting you in harm's way when it comes to all the things that these hormone challenges can present. So a few things that I like to have my women get at this age: I really like having a coronary calcium screen. So it's a test that St. Dominic's or Baptist in our area can do. Really, any major hospital offers this. It's a CT of the chest where they do a calculated calcium score to look for plaquing. So that would be something I would want to make sure that we do. I would also want to make sure that we look at inflammatory markers. So looking at C-reactive protein is really, really important, looking at inflammation, because we know that hormone production is important. But if the hormone can't get to the cell because the cell is inflamed and it gets diverted to other uses, then we could be putting you at risk. So I always want to make sure that we understand the inflammatory burden, and I always want to make sure that we understand our plaque burden going into hormone replacement therapy, so that we're keeping you safe as we go about our business. Let's face it, cardiovascular death is the number one killer of females. And oftentimes we're not talking about that. We're spending a lot of time thinking about breast cancer risk, but not enough time thinking about cardiovascular risk. So I want to make sure that that is done. Also, I want to point the finger to other providers that I feel like are doing a really good job keeping their head in the research. So if you're looking for someone to follow on this menopausal, postmenopausal platform, I do believe Sarah Gottfried, Gottfried. She's now going by Saul's, Sczal. She has she's keeping her head in the research. She's an OBGYN, Berkeley trained, and she's got a lot of content out there on webinars, on podcasts, and she really is research-based. I don't always agree with a lot of the lifestyle things that she recommends, but from a research standpoint, really looking through the research on what it tells us about replacing hormones for women in this phase of life, I think she's spot on. And so I think she's worth following. So we look at the triad of hormones. I mentioned your sex hormones, really, really important. Ovaries are your primary producers of your sex hormones. We think about estrogens, we think about progesterone, we think about testosterone, right? But I also mentioned we have a backup plan, and that's the adrenal glands. So the adrenal glands, we often think about cortisol, which is really important. But they also produce DHEA, and DHEA can turn into estrogen, progesterone, and testosterone. So if we have a woman that hasn't had a whole lot of stress, I really don't know anybody like that. But if we do, we had someone that has not had a whole lot of stress by the time they hit menopause, sometimes their adrenal glands are healthy enough to produce adequate amounts of hormones, or we don't really have to add to their hormone picture in the way of replacement. Unfortunately, in America, a lot of times by the time we get to menopause, we've lived a lot of life. We've had a lot of stressors. We've had a lot of chronic hits to the adrenal glands that makes this less likely, but it is possible. So I do feel like spending the time in looking at adrenal output, looking at, are we making enough DHEA? DHEA is a hormone. It's made by the adrenals. It's very protective when it protects us against autoimmune conditions if it's normal. And so supporting DHEA is a really important part of the hormone cascade. I mentioned chronic stress over time. Chronic stress over time can increase cortisol output, which over time can increase insulin resistance and cause some belly fat accumulation. Sometimes those symptoms show up as fatigue or anxiety. weight gain, especially that stubborn belly fat that we just can't get rid of. Sometimes that is related to chronic stress over time and dysregulation in cortisol, and that can be corrected. And then last but not least is your thyroid hormones. Oftentimes when sex hormones and adrenal hormones are dysregulated, thyroid hormone will also get dysregulated. That doesn't always mean hypothyroidism, which can happen, right? Females have more prevalence for hypothyroidism, and that is a real condition and something that needs to be looked at. But beyond that, sometimes we can have subclinical hypothyroidism where we just have downregulation of thyroid hormone utilization. So in all of these hormone balancing protocols, we want to make sure that we're paying close attention to your nutrient status. We need nutrients to drive hormone conversion. So when we think about hormone balance, we're not just thinking about production, which again, for sex hormones ends at menopause as far as ovarian output. We think about production. We think about processing. How is your liver processing these hormones? And that processing is very dependent on nutrient status. It's also very dependent on less inflammation. And then we think about proteomics, getting that hormone into the cell so that it can do its work. So when we're looking at hormones at Enhanced Wellness Living, we're looking really deep and wide in what is creating the challenge and what are the best ways that we can help you address those challenges so that you get resolution of symptoms, but also reduction in risk of chronic disease states. So super, super important that we're looking at that. So why is hormone balance so important as we age? And I get to sit with women every day. In fact, I had two yesterday. One that was concerned about brain health, and she was 72, had not been on hormone replacement therapy. She's got two siblings with dementia that are older, and she's super concerned about her cognitive health. Now, she's cognitively very well intact. She is a runner. She eats well. She's been living a really, really nice lifestyle for quite some time. But when we did her cardiac calcium score, she had excessive buildup in her LAD. And so we had to have the conversation, is it appropriate to add hormones to help with prevention of dementia? Because we know that that is one of the best ways that we can help prevent dementia is keeping estrogen levels vibrant through menopausal phase. But is it worth the risk because she's got that elevated calcium score? And we decided at this moment it's not worth the risk. She's doing really well with her adrenal health, her thyroid health, all of her lifestyle things look really, really intact. And so we paused that button and really are just focusing on supporting her adrenal gland. So that was a really good discussion. I had another patient that I met with yesterday and very concerned about bone health, right? And she's in a very similar situation. She was at that age, they're both in their 70s. They were at the age where they were told absolutely no hormones because of the Women's Health Initiative that came out. And so they're kind of falling into that category. What we know about hormone utilization is if we start it within the first 5 years of menopause, we're actually reducing the risk of cardiovascular issues. But if there's a delay beyond 5 years, and if there is plaque buildup, then we are running the risk of disturbing that plaque by adding estrogen. And so we have to look at other ways to support someone hormonally other than just adding estrogen if we have a plaque burden. So for both of these women, they did have a plaque burden. And so we decided to take other measures, which can be done. So even if you're falling into that group where cardiovascular risks are there, we've passed that window of opportunity for initiating hormone replacement therapy without increasing your risk. There are plenty of other things that we can do to protect you. So as estrogen lowers, and I want to make sure I make this point, as estrogen lowers, so does the ability to absorb calcium. And calcium is really, really important for bone health. But if you have low estrogen and you think, I'm just going to override this by taking more calcium, you can be plaquing that calcium. The plaquing in the cardiovascular architecture is calcium based. And so we're not always winning if we're just adding calcium to the mix. We want to be looking at things like vitamin D. We want to be looking at magnesium. We want to be looking at lowering your level of inflammation. And we want to be making sure we're getting calcium from a food-based source, not just calcium carbonate, okay? Cognitive changes, I mentioned that's a big area of concern for women at this age. We want to make sure we stay cognitively intact. And oftentimes we're experiencing brain fog, right? Fatigue, mental fatigue, where we just tap out by the end of the day because we just don't have the brain power that we used to have. And that can be a result of not just lack of estrogen, but also lack of progesterone and testosterone. Testosterone is a big deal for the brain. Testosterone drives dopamine, and dopamine drives motivation and drive. So those are really, really important hormones when we think about the changes that can happen cognitively as we age. And then, as I mentioned earlier, when cortisol gets dysregulated, a lot of times we'll have belly fat accumulation. As estrogen declines, so does our ability to manage our insulin levels. So, one of the things that we love to do here is monitor with continuous glucose monitoring blood sugar. Because if we can teach you what's driving blood sugar, and sometimes it's beyond what you're eating is super important, but sometimes it's stress level, lack of sleep, sometimes occult infections or food sensitivities that are driving dysregulation in blood sugar and driving that weight gain that's just really, really stubborn. So again, thinking just a little bit beyond hormones in and of themselves. The other thing that I want to make you aware of is the pelvic floor. As women, our pelvic floor changes with childbirth. It changes with aging, it changes with hormone balance. And basically, our pelvic floor is a group of muscles. And I did a really fun podcast with Jody Joyner. She's a pelvic floor physical therapist. She did such a great interview with me talking about the pelvic floor. So if you want more content here, I'd encourage you to go over to our podcast and listen to that interview because we really talk about the importance of the pelvic floor and how important those muscles are. So the number one reason women go into assisted care as they age has to do with bladder and bowel incontinence. And that's where the pelvic floor is so important. These muscles that contract and control our bowel and bladder function get impacted by changes in hormones. And so when we have issues with the pelvic floor, we can have urinary incontinence where we cough, sneeze, jump, laugh, lose control. Sometimes urge incontinence where when we got to go, we've got to go. There's just not any control, right? Those are important things to address. And there are plenty of things that we can do to help resolve those issues. Sometimes there's pelvic floor prolapse. I mentioned with pregnancy, sometimes gravity just takes that pelvic floor down and we'll have some prolapse there. Sometimes that's a surgical issue where, we may need a hysterectomy if that prolapse is severe. Sometimes it's strengthening that pelvic floor with pelvic floor physical therapy. I mentioned fecal incontinence. This is something that most women don't talk about with their friends, but it is a very common complaint that happens. And it can be due to hormonal issues. It can be injury due to childbirth that happened. There's a lot of issues there. And oftentimes pelvic floor physical therapy can help resolve that issue. Sometimes going between constipation and diarrhea can exacerbate those issues. Chronic pelvic pain is also an issue, and this can happen at any time of life, but especially as estrogen declines, that vaginal tissue becomes more friable, more easily to tear, and become challenging. And so really learning about that and what we can do to correct for that. And then painful intercourse. As we have lack of estrogen, lack of lubrication, lack of blood flow, and again, this goes back oftentimes to cardiovascular changes as to why we have lack of blood flow that can create pelvic floor changes and pain with intercourse. So when we think about the pelvic floor and the pelvic floor tissue, it's very responsive to estrogen. So sometimes if we're having lack of blood flow and lack of lubrication and irritation in the vaginal area, postmenopausally, sometimes using some vaginal estrogen is a very good tool. Sometimes using vaginal estrogen around the urethra, right, and in the vaginal area can help strengthen the collagen that prevents urinary incontinence. So sometimes it's something as simple as that, right? So really talking to your provider about what you're experiencing so that the right tool for the right challenge can be addressed. The other thing I mentioned is strengthening that pelvic floor, and we have some really cool tools to do that. One is called Votiva, and it's radio frequency technology that helps strengthen the collagen, tighten the tissue. I mentioned stimulating some collagen so that that tissue responds to therapy and we're not having issues with incontinence. So it's been one of the best tools for urinary incontinence that we have ever had. It's really exciting to take someone that has struggled with incontinence. I had a patient a couple of years ago that could not concentrate during her visits with me. We were having some lifestyle visits around just general health, and She was constantly thinking about, where is the bathroom? Do I need to go to the bathroom? And it wasn't until a few visits in that we started talking about her challenges with urinary incontinence. She did the Votiva treatments, and I was amazed at how relaxed she was at subsequent visits and how able she was to concentrate on what we were trying to accomplish. So sometimes we don't even realize how much brain space it's taking up to think about just our everyday bodily needs when it comes to incontinence. So I'd encourage you to reach out if you're really having a problem with that. The other tool that we have that really helps with blood flow. So if your issue is vaginal dryness or pain with intercourse or blood flow issues to the pelvic region, we're using FEMI-wave, which is acoustic wave therapy. It actually stimulates the tissue to regrow blood vessels to help with blood flow to the area. So we see that help a lot with vaginal dryness and also with sensation. And then, of course, we can do O-shot, and O-shot helps not only with sensation of the vaginal area and the clitoral area, but also with the incontinence issue. So we've got some really cool tools, everything, like I said, from topical estrogen all the way to more advanced procedures, depending on what you're experiencing. So again, reach out to talk about these things with your provider, because these are, if they're important to you, they're important to us, and we want to make sure that we're using the right tool to address the right problem. I mentioned that, excuse me, guys, I'm going to get a little drink of water. I mentioned that estrogen declines as we age. I mentioned that estrogen helps with collagen production. And we think about this, we see collagen in our face. We oftentimes think about changes that we see in our face with wrinkles and with sagging and falling skin. The same thing is happening in the pelvic floor, right? And so other things that can affect this are prior surgeries, radiation, hormonal issues that lower estrogen, and those things can further weaken the pelvic floor. So again, we want to make sure that we're talking about all of the layers of things that can affect what's going on in the vaginal and pelvic floor. I mentioned earlier nutrition for menopause, and this is really important through every phase of life. But I think a lot of times the thing that gets missed during this phase of life is digestive health in general. Oftentimes by this time, we think that if we have constipation that's chronic, that it's just the way we are, and there's nothing that can be done about it. We oftentimes don't think about the impact of having chronic constipation over time, or having things that prevent us from absorbing our nutrients. So as we age about age 40, we start decreasing our ability to absorb key nutrients, and that progresses over time. And so the quality of the food that we get in, the nutrient value of that food that we get in is extremely important. So let's talk about, I mentioned earlier, some food products that contain high calcium. We want to make sure that we're getting our calcium through food sources because of absorption and conversion. So your green leafy vegetables, things like kale, collard, spinach, arugula, super high in calcium and also in vitamin K that helps with absorption. Also non-dairy alternatives to milks. We were sold a lot when all those milk commercials got milk, and they talked all about bone health, but really we get more absorption from our plant-based sources of calcium than we do from dairy. Dairy can be very acidic, which prevents the absorption of calcium, so non-dairy would be best. And then our nuts and seeds. Oftentimes we forget about adding these things to our salads, to our smoothies, to our soups, to add a little crunch, but also nutrient value too. And then our fatty fish, things like salmon, sardines, both are rich in calcium and vitamin D. I mentioned earlier about getting hormones intracellular. And if we have a lot of inflammation, we can't do that well. If we don't have enough omega-3s, we don't do that well. And your omega-3s, like your fish oil, are super important for cognitive function, for cardiovascular health, and for intracellular uptake of hormones. And so I consulted with a patient yesterday that had been on fish oil. She brought a bunch of labs into me, and she had had an omega-3 index done while on her fish oil, and it was horrible, right? The fish oil that she was getting was not good quality. It was something off the shelf. It was not tested for purity or quality. And as a result of that, we can build up cell membranes that aren't so healthy. So we always want to make sure that our omega-3s are pharmaceutical grade, that they're screened for purity, and that we follow that with an omega-3 index to make sure they're actually getting what we think we're getting. So fish that are fatty contain these omega-3s, things like salmon, tuna, mackerel. We want to make sure we're working that into our diet a couple of times a week and that um, we're not getting farm raised, we're getting wild caught in those ways. Also, nuts. I think walnuts should be on our plate at least 3 to 4 times a week because of the brain power that they pack. And if you look at the structure of a walnut, it looks like a brain. There's a reason for that. So think about brain health. Again, with your nuts and seeds, it doesn't take much, like a fourth of a cup. So it's not like you have to get a lot of them in your diet, but we want to get them in your diet consistently. The other lifestyle things that we want to make sure that we're doing for menopause is we need to be moving our body, right? Our bodies are meant to move. We want to be getting about 150 minutes of low impact cardiovascular, and that could be walking, that could be biking, about 150 minutes a week. And we want at least 2 to 3 sessions of strength training a week. And strength training could be yoga, it could be Pilates, it could be weight training, it could be body strength training. Any of those matter. We want diversity in that, but we need the tension of the muscle on the bone to protect our bones. And one of the life hacks I like to give to check for am I losing bone is checking your urinary pH. The easy way to do that is just to get some pH strips first thing in the morning, TT on that strip and see what you're running. Your urinary pH should be 6.5 or higher. If you are running acidic, you are wasting your bone to create alkalinity. So you really want to work toward getting more alkaline. And how do we do that? Primarily through our plant-based food, so lots of vegetable intake. And then reducing sugar intake, anything that's going to make you more acidic. And sugar is the #1 acidifier on the planet, will make you waste bone. So really working on alkaline. The other thing is finding joy. And so I feel like as we age, we either get better or we get bitter. And it's really easy to get better, especially in today's world where so many things are coming at us, so many life demands and all the stressors of day to day. We have to really work hard to cultivate gratitude, to cultivate joy, to cultivate mindfulness. So developing some type of mindful practice. This year in the practice, we read The Miracle Morning, which talked about, how to set your day up for success by having some time in the morning for meditation, for prayer, for affirmations, if you're into that. Really getting your mind right about embracing your day can go a long way of helping you do that. Also, getting some outside time. We need to be spending time outside, especially early in the day. That rise of sunshine in the morning is what primes our body for production of melatonin. And melatonin is a key hormone that helps us repair at night while we're sleeping. It's an anti-inflammatory, it's an antioxidant. Melatonin is a hormone, but yes, it's an antioxidant. So we need natural production of melatonin. So getting some outside time in the morning. And then at night, making sure that we are keeping the lights dim and that we're not getting a lot of screen time at night because we need darkness and coldness to release melatonin at night. So bedrooms, 68 degrees or colder, and all of my menopausal women, most of them love hearing that. The men, not so much at this age. The 68 degrees or colder, and then completely dark, no lights at all in the bedroom to help release melatonin. Also using some things, if you do have challenges with sleep, like chamomile tea, valerian root. If you have a busy mind, I really like L-theanine to help with just that mind busyness and help. It won't put you to sleep, but it'll help the brain relax. And then I'm a big fan of journaling. I'm also a big fan of counseling. If you need to process things, it helps sometimes to talk things over with someone that can help you process your emotions and process what's happening. And so all of these things are really, really important when it comes to creating a body that's receptive to hormone balance and that can keep you balanced long term. So let's talk a little bit about endocrine disruptors and what does that even mean? So things that disturb hormone balance are considered endocrine disruptors. And I just interviewed Dr. Deanna Minnick on our podcast. It'll be releasing in a few weeks about melatonin and the mitochondria. And we got into this whole endocrine disruptor conversation. And she added to my list that I don't have on here, but she said lack of darkness is an endocrine disruptor. So at night, being on those computers, keeping the lights up at night is an endocrine disruptor. It disrupts the way your hormones are utilized. So I would say let's work on some nighttime routine and making sure we get those lights down. The other things that will disrupt hormones are things that we get exposed to environmentally. So to keep it simple, we think about clean air. So if you don't have air filtration in your home, get some freestanding air filters, especially for your bedroom. Clean water. So I'm a big fan of water filtration and making sure that if you're using a water filter that you are replacing your minerals. And then if you can get some spring water that has natural minerals in it, even better. But we don't want to be drinking out of water bottles, right? So glass is a little bit harder to obtain in that way and pretty expensive. So I'm a big fan of filters for that reason. And then clean food. So we oftentimes look at the Dirty Dozen list to make sure that we're getting the Dirty Dozen foods organically. And then there's also a Clean 15 list of things that we don't have to worry about organic so much. But things in our environment, chemicals, pesticides, herbicides, definitely impact the way that we produce our hormones, the way we process our hormones, and the way that we utilize our hormones. So they are a big deal. I mentioned earlier that sugar is the #1 endocrine disruptor. It's the #1 inflammagen. So if I had to give you one piece of advice, it would be get the sugar out. We oftentimes have the conversation about caffeine and alcohol here. I'm not anti-caffeine and I'm not anti-alcohol, but I want to be smart about it. So when we look at your adrenal health, if your adrenals are not functioning properly or if there's a lot of adrenal stress, I do think changing your caffeine consumption to a green tea caffeine is really, really smart because green tea is very calming to the adrenals and it doesn't affect the way that your liver processes your hormones. So if your goal is hormone balance and you really want clean energy, sometimes the caffeine in coffee is not giving you what you think it is. And then alcohol, not all alcohol is produced equally. And really the studies on women and alcohol are telling us there's really not a safe level of alcohol. So really being thoughtful about consumption, being mindful about consumption of alcohol. What is it really doing for you? Is it really helping you relax or is it disturbing your sleep? I find that most of my menopausal females will admit that when they drink alcohol, they just don't sleep as well. And sleep is your time to repair and restore. So we want to make sure that we really are paying attention to what sleep is doing for us. So again, just some quick little things that you could be doing to help decrease endocrine disruption. We can't live in a bubble, but we want to be making sure that we're mindful on the things that we do. So these are some cool tips that just are swaps that you can do in your lifestyle. So things that you're using to clean, think just simple ingredients like baking soda and vinegar can be really strong, powerful ways to clean. Hydrogen peroxide is another one that's a stain remover. So really questioning, do I need all those different cleaners in my house or could I really simplify things and decrease exposure? They say most of the chemicals that we're exposed to are actually inside our home. So we're bringing them in skincare, we're bringing them in cleaning products, we're bringing them in the food that we're purchasing. So really just being mindful of that. And then, as I mentioned earlier, plastic water bottles is one of the #1 ways that we're getting exposed to BPA. The other way is through money, right? Money handling or receipts. So the ink that's on receipts contains um, um, it contains chemicals that are endocrine disruptors. So making sure we're not doing that a whole lot. Changing out deodorants because we know that our deodorants that are conventionally made have aluminum in them. There's plenty of natural deodorants now that you can use. Changing from plastic food containers to glass containers or silicone bags. Changing out your feminine hygiene products if you're still using feminine hygiene products in the perimenopausal or premenopausal time frame. And then your cookware, right? Using nonstick cookware contains a lot of chemicals that our body just doesn't handle so well. So pick one of these things and change one thing at a time in the way that you're using. Don't get overwhelmed with all the different things that you need to do, but think about, okay, what's an area that I can dig into next and start changing the things that may be disrupting hormone balance for a lifetime. So if I were going to write you a prescription for hormone balancing, one of the first things that would be on there, and I mentioned continuous glucose monitoring earlier, one of the first things that would be on there would be balancing your blood sugar, because we know that blood sugar dysregulation is going to dysregulate cortisol, which is going to take energy away from how your body is handling the day-to-day processes. So balancing blood sugar is really, really important. We spend a lot of time talking to you guys about how do we balance blood sugar through diet, through lifestyle. And I mentioned it's not just the food you're eating. The food's important, but it's the stress level, it's the sleep, it's the moving of the body, it's what's going on physiologically with physiological stressors. And then I mentioned reducing exposure to plastics, reducing exposure to chemicals, reducing exposure to conventionally raised meats, things that would harbor antibiotics and chemicals that would disrupt hormone production and utilization. And then stress management techniques. What are you doing? How stressed is your body? What do you need to be building into that lifestyle? And I think if we live in America, we just need something baked into our lifestyle that we can be doing on a consistent basis that we know that sends the signal to the body, it's time to decompress. It's time to repair. We're either stuck in fight or flight where we're wearing and tearing, or we're in parasympathetic resilience building space. We can't be in both. And so we need both. We need to be able to go when we need to go, but we also need to decompress when we need to decompress. So teaching the body, the only way the body learns that is if we teach the body how to behave. And then addressing the underlying conditions. And this is often missed with hormone therapy. You go in, you complain about hot flashes, night sweats, you just get put on a prescription and sent on your way. But what are we doing to address the underlying conditions that may be creating inflammation, addressing body composition? I mentioned estrogen production beyond the ovaries oftentimes is coming from fat tissue. So your fat tissue converts estrogen into a very potent estrogen that can be problematic as we age. Thyroid issues definitely need to be addressed. High blood pressure, sleep apnea. These are things that are underlying the current sometimes that often just get dismissed because it's just how you've been, and they're really not thought about in the way of what can we be doing to address these underlying issues so that they're not interfering with hormone balance long term. So there's many ways that we can test hormones. And I don't think there's one way for every person or one way for every stage of life. I view hormone testing as looking in different mirrors. So when you're driving a car, you have a rear view mirror, you have your side mirrors, you have the ability to move your head, and you're looking through the front windshield, right? And so I look at hormone testing in much of that way. There are certain things that we see in blood that make sense. I love looking at thyroid hormone through blood testing. When I'm looking at adrenal hormones, I like salivary testing. But when I'm really wanting to look comprehensively at how your body is producing, utilizing, and processing hormones, the Dutch urine kit is phenomenal because we can see what are the pathways these hormones are taking and what are the things that I can be doing to help this person prevent problems, metabolize their hormones better, keep themselves safe, and stay balanced for life. I oftentimes get the question, like, how long should I be taking these hormones? And I'm like, well, how long do you want to feel good? How long do you want to have good brain health? How long do you want to have good bone health? There's no unsafe age. There are unsafe circumstances like comorbid situations or inflammation drivers. But age alone is not the risk factor. It's really what happens with aging that is. So investing in the testing, I think, is really important. If you're on hormone replacement therapy, I do believe that doing the Dutch kit once a year can really help you navigate better and keep you out of the weeds, give you some confidence in what you're doing in the way of preventing other disease states from creeping in. So I do think that would be worth doing at least once a year. If things are changed, sometimes twice a year is helpful, but definitely just once a year looking at those hormones. So I oftentimes get the question, this question came in a lot as we put together this Women's Health Summit, like, what is the best way to use hormones? And I'll tell you right now, there's not one best way. There's a lot of different options when it comes to hormone replacement therapy. And I think that the stages of your life matter. I think that the what you're trying to accomplish with hormones matter, what your risk factors are matter, and they all go into the decision about what hormone we're using for what time and what delivery method. So in the world of conventional hormones, I was working in a women's health clinic back in the early 2000s when the Women's Health Initiative came out, and we were primarily using Premarin and Provera and Prempro, okay? And those are synthetically derived hormones, Those were what was used in that Women's Health Initiative study, and that's what we took women off of, right? And at the time, we really didn't have options for bioidentical hormone replacement therapy, so we had a big hole. So some of you guys are falling into the gap where you're aging out when you were told hormones are absolutely not an option. But luckily, due to women that just were not willing to go with the flow of not having hormone balance, we had the production of bioidentical hormone replacement therapy, where we can customize dosing. When we're looking at synthetic dosing of hormones, oftentimes those hormones are coming in very set dosages, and we don't have a lot of wiggle room to manipulate dosing. Now, there are some hormones that are prescription that you can get at your conventional pharmacy that are bioidentical, like the estrogen patches are bioidentical. We have some forms of progesterone that are bioidentical. So just because we're prescribing and you get them from a regular pharmacy doesn't mean they're not bioidentical. But we are limited to dosing. Like our progesterone comes in a 100 and a 200. If you need 125 or 75, we can't help you out in that way. We have to have that compounded. And that's why I love compounding, because we can dial in the dose specifically for what you need for any given time. When we look at hormone replacement therapy, we have creams, we have gels, we have troches, we have patches, we have pellets, we have injections. There's a lot to choose from. So deciding what someone needs is very dependent, again, on what your goals are, how old you are, what your comorbid conditions are, what you're willing to do, right? And so I'm a big fan of pellets in the perimenopausal and early postmenopausal phase, because I do think there's some advantages for brain health in relationship to what I see people describe with pellet usage. So I'm a big fan of supporting not just estrogen and progesterone, but also supporting testosterone in that way. So oftentimes you'll see us use that, especially early, and then maybe phase out to creams and oral progesterone at some point. And so just be aware that there are many options for hormone replacement therapy. So if you've tried it before and you weren't a fan, it could have been your delivery method. It could have been the substance that you were prescribed. And so just because you didn't do well before doesn't mean you won't in the future. The other thing that I feel extremely strong about is, again, looking at your levels of inflammation, controlling for inflammation before we initiate hormone replacement therapy. And this oftentimes gets missed. So for what I'll say to the female that tried hormones before that didn't necessarily do well, perhaps it was because your inflammation drivers were really out of control and inflammation wasn't controlled for. And so I would say back up a little bit. Let's control for inflammation. One of the things that I love doing initially is having someone do a metabolic reset, because we know that reset lowers inflammation. It balances out blood sugar and other key regulatory hormones, and it builds up metabolic reserves when it comes to nutrients needed to balance hormones. So sometimes after the reset, when we put hormones into the mix, they just work better. And that reset is a tool that you can go back to periodically. I say a few times a year, do a reset, because that reset is going to keep those hormone receptors working better for you and keep you hormonally balanced throughout life, so that you're not chasing dose of hormone so much. So right now we do have a special going on. Because you participated in this Women's Health Summit, we are offering some discounts on women's health procedures. I mentioned Votiva, I mentioned FemiWave. Those are really, really awesome procedures to help the pelvic floor. We're also offering some discounts on testing. So if that's something that you're interested in, definitely reach out to Chelsea. We have the number here, 601-724-7882. Or you can email us at ewlliving.info@gmail.com. And let us know what you're interested in doing. We also want to connect. So we're on Facebook, we're on Instagram, of course, our website. If you did nothing else today, say you're not a current patient of Enhanced Wellness Living, but you're interested in what we do, going to our website, really spending some time going through all of the exceptional information that our team put together, be there, reading some of the blogs, looking at some of the recipes. If you just started with that and started cleaning some things up, you would definitely notice some improvement in your overall health. So connect with us. Questions, we welcome questions. Reaching out with those questions helps us fuel future content production. So definitely we want to hear from you. And again, we just appreciate you being here. We appreciate your time and your energy that you're putting in to making your life the life that you want to live.
Thank you all so much for joining us for our Women's Health Hormone Summit. Do reach out to me. We are here to support you and help you live life well. Take care.